The hip isn't just a ball and socket joint. It's a powerhouse of movement. Every step we take, every time we climb stairs, sit, or kick a ball, dozens of muscles are working in perfect harmony. To make this easier, let's break the muscles down into functional groups: flexors, extensors, abductors, adductors, and external rotators. I'll also give you a few mnemonics along the way to help you remember them. 1. Hip flexors. The hip flexors are the muscles that bring the thigh forward, like when you walk upstairs or lift your leg to put on socks. The key players are iliopsoas, the most powerful hip flexor. It's actually two muscles, the psoas major and the iliacus, which merge and insert into the lesser trochanter. Think of it as the engine of hip flexion. Rectus femoris, one of the quadraceps crossing both the hip and the knee. That's why it flexes the hip and extends the knee. Sartorius, the longest muscle in the body, running diagonally across the thigh. It flexes, abducts, and externally rotates the hip, a movement combination we jokingly call the tailor's position, like crossing your legs. Pectineus, located near the groin, it flexes and also adducts the hip. Iliacus, often considered part of the iliopsoas, but worth mentioning separately. Key mnemonic for hip flexors: I really saw people inside. That's iliopsoas, rectus femoris, sartorius, pectineus, iliacus. 2. Hip adductors. The adductors pull the thigh toward the midline, like when you squeeze your knees together. They're located in the medial compartment. The main ones are adductor magnus, the adductor portion, the largest and most powerful; adductor longus, long and more superficial, often injured in athletes with groin strains; adductor brevis, a short adductor sitting deep to the longus; adductor minimus, sometimes considered a part of adductor magnus but worth noting separately; gracilis, a thin, strap-like muscle that also flexes the knee. Key mnemonic for adductors are: all boys must love girls. Adductor magnus, brevis, minimus, longus, gracilis. Clinical pearl: adductor longus injuries are common in soccer players due to sudden forceful adduction. 3. External rotators. These muscles rotate the hip outward, like when you point your toes to the side. They're sometimes called the short external rotators, and they're surgical landmarks during hip replacement. They include gluteus maximus, the largest muscle of the hip. Besides being an extensor, it also contributes to external rotation; piriformis, running from the sacrum to the greater trochanter, clinically important because the sciatic nerve passes just below it; obturator externus, obturator internus, superior gemellis, inferior gemellis, quadratus femoris, a strong square-shaped muscle. Key mnemonic for external rotators are go poix. That's gluteus maximus, obturator externus, piriformis, obturator internus, quadratus femoris, superior and inferior gemelli. Clinical pearl: these small muscles act like rotator cuff muscles of the hip, stabilizing the femoral head inside the acetabulum. 4. Hip abductors. Abductors move the leg away from the midline, like when you spread your legs apart. They're critical for gait. The key muscles are gluteus medius, the most important abductor, also stabilizes the pelvis when standing on one leg; gluteus minimus, a smaller, deeper version of gluteus medius; tensor fasciae latae, or TFL, located on the lateral thigh, blending into the iliotibial band. Clinical pearl. Damage to the superior gluteal nerve paralyzes these adductors, causing Trendelenburg gait, where the pelvis drops on the opposite side. Key mnemonic for adductors are, make my tailor. 5. Hip extensors. The extensors pull the thigh backward, like when you rise from a chair, climb stairs, or sprint. They include gluteus maximus, the powerhouse of hip extension. Without it, climbing stairs would be almost impossible. Hamstrings, the semitendinosus, the semimembranosus, and the long head of the biceps femoris. These extend the hip and flex the knee. Adductor magnus, the hamstring portion, often forgotten, but it contributes as well. Key mnemonic for extensors are good, strong, ham, add. That's gluteus maximus, semitendinosus, hamstrings, that's the semimembranosus and the biceps long head, adductor magnus, the hamstring portion. Clinical integration. Hip flexors are tested when asking a patient to lift their thigh while seated. Weakness suggests femoral nerve injury. Hip adductors, weakness may indicate obturator nerve damage. External rotators are important for hip stability during surgery. Injury can cause increased risk of dislocation after arthroplasty. Hip abductors are essential for walking. Superior gluteal nerve damage equals Trendelenburg gait. Hip extensors are essential for propulsion. Weakness equals difficulty standing or climbing stairs. Closing. So, to sum up, the muscles of the hip can be remembered with a few mnemonics. Flexors. I really saw people inside. Adductors. All boys must love girls. External rotators. Go poix. Abductors. Make my tailor. Extensors. Good, strong, ham, add.